Axel Left time means it's Lagos Talks time. That is what we're going to be diving into right now. You get to talk Lagos, we talk to you, you talk to us as well. It's going to be a conversation, and this is where real conversations lie. Welcome into another amazing conversation on the horizon on Smooth 98.1. The Smooth Breakfast. It's kicking on really nicely. My name is Ayokunmi. Thank you for keeping it tuned all the way up until this point. And this morning, it's going to be a very insightful one, a conversation that needs to be had. I'm all for education and getting the right information out there, really and truly. Today is the 24th day of October, 2025, and it is World Polio Day. We are talking about polio today. Now, I know that many of you are probably thinking, didn't we already beat polio? Well, it is true that Nigeria achieved a monumental public health victory in 2020 when we were certified free of wild polio virus. And I would say that it was a day of national pride. But the fight is definitely not over. It just has simply changed, if I can put it that way. To help us understand where we're coming from, where we are, and where it is that we are going to in terms of beating this particular virus completely. I have with me a very special guest in the person of Dr. Anire Chima-Oduko. She is a respected public health physician. She's joining me on Zoom this morning. Good morning to you, Dr. Anire. Very, very, very good to have you join us this morning.
Good morning. Thank you very much for having me and having this conversation.
It is a very key conversation to have talking about polio. Like I said, when you talk about polio, a lot of people will think, polio, we've gone past that already. But that would be very, very dangerous to actually think in that direction. We always need to be on our toes 24/7. Now, this is a discussion that we would love you to get on board with. Any comments, any questions that you might have, anything you've heard where polio is concerned that you just want to ask the good doctor, clarify this for me, get across to us, give us a call, send a message. The studio line is 0700 2255 981. 0700 2255 981. The WhatsApp number is 0911 999 0981. 0911 999 0981. Now, I will say for today, on WhatsApp, you can only send your messages. So any questions you might have, just send it in a message. If you want to actually call, it's on the studio line, 0700 2255 981. So please do indulge us in that regard. Okay, let's dive right into the heart of this conversation. For I would say a new generation of parents out there who thankfully have never seen a case of polio. I want to imagine they haven't. The urgency might not be, might not feel kind of real. So let's cover the absolute basics, start from the ground and work our way up. What exactly is polio? How does it spread? And who is most at risk?
Okay, so polio is the short form for poliomyelitis. It is a viral disease caused by virus, polio virus,
Okay.
and it is very infectious. And it primarily affects children under 5 years old, although older people can also be affected, but it really targets children under 5 years old. And
Okay.
the virus enters the mouth through contaminated food, water, or hands, and it replicates in the gut, and it can invade the nervous system. And then when it does that, it can affect the nerves, leading to paralysis. So that's why it's so dangerous. It causes paralysis of the nerves, and so people cannot walk anymore. And sometimes, if it affects the respiratory muscles, the muscles that control how we breathe, it can lead to death. Because if there's paralysis of your respiratory muscles, it means you can no longer breathe. And so
True.
it can lead to death. So that is what polio is in a nutshell. You asked how it spreads. I said we call it fecal oral, through your hands, your food, feces. Some of the virus when you go to the toilet, some of the virus are shared when you pass your stool or feces. And if you don't
Okay.
wash your hands properly, use it to cook, you can introduce the virus into your
Oh
system.
dear.
So it's, yes, that's how it spreads.
Okay. Just thinking about that, it sounds very scary. So basically, one needs to practice absolute cleanliness, sanitation,
Yes,
being
safe
clean. It is
hygiene. Yes, very
wow.
important.
Okay, so let's just imagine that unfortunately someone didn't wash his or her hands properly, went to
Hmm.
cook, and then the virus has, mixed with the food, as it were, and something begins to happen in the body.
Hmm.
What are the common symptoms that parents actually, or anyone really, should actually watch out for?
Okay, to be honest, in about 90% of cases, there might not be any symptoms.
Oh,
Or
wow.
even if there are, it will be mild flu-like symptoms, like it's a virus. So viral symptoms like fever, sore throat, headache, fatigue, stomach pain, vomiting, just non-specific symptoms that you could even think is malaria, so you're not sure. However, in a small percentage of people, about 10% of people, that virus will go onto the nervous system. It will attack the nervous system and cause what we call acute flaccid paralysis, weakness of the muscles, especially in the limbs.
Okay, okay, okay.
Yes, it likes the limbs, the lower limbs. So there'll be sudden weakness. The person cannot, just weak. And over time, this can progress. So that's what happens. So sometimes, most times, in about 80% of, so that's why it spreads fast. It's spreading. You might not even know it's spreading because in some people there might not be symptoms. But in a critical 10%, it can even be higher. That's when symptoms occur. And the one we don't want is the one where it destroys um the neurons in the nervous system, controlling movements,
Okay.
causing paralysis. And then if it also spreads to the respiratory system, it can attack the muscles there, and the person is unable to breathe because the muscles there are paralyzed. So those are really the
Uh,
symptoms.
okay, now, from everything you just mentioned, that is just a terrifying picture. Just thinking about everything that begins to happen, in the body, and the fact that, as you mentioned, 90% of cases won't even present with
Yes,
any
will not.
symptoms whatsoever.
But they can
So,
spread it.
uh,
So they are spreading it, but they don't have symptoms. So that's just the irony of it.
uh, being asymptomatic. Anyways, that just brings me back to that specific story where Nigeria is concerned, in 2020, where we all felt, okay, we've won a huge battle and all that. So this is going to be a three-part question here. So indulge me for just dropping this back to back. Looking at
All
what
right.
happened in 2020, I mean, why is polio still a concern in Nigeria and globally? Because we often hear that it's almost eradicated, and Nigeria was certified polio free in 2020. I mean, how was this actually possible?
Okay.
And very importantly, what factors can make the polio virus reemerge in a country that's already polio free?
Okay. So thank you for that question. Yes, we were certified polio free in 2020. However, the truth is, once any child anywhere is still at risk, all children everywhere in the world are at risk. That's why, the world is now a global village. We move fast.
True.
Things like that spread fast. I told you that it can be, not everybody presents. So they can be spreading it and nobody knows. So it's still a problem because there are still two countries in the world where we still have polio that is as a normal thing, Afghanistan and Pakistan. Recently,
Right.
during the war in Gaza, Israel, there were also outbreaks of polio, essentially
Mm.
because there was disruption in vaccination. So you see,
Okay.
Gaza did
Okay.
not, Israel did not have polio, but just because there was a disruption in vaccination because of the war, they started having polio cases. So as long as we still have polio in the world somewhere else, anyone is at risk. So we still need to continue intensifying our vaccination and immunization efforts to keep people protected until we are able to eradicate it from everywhere in the world and everybody is safe. So nobody is safe as long as it is still present because it spreads rapidly. So that's why it's still an issue. Yes, we've been certified polio free, but there's something called wild polio virus, which can still be in the environment and
I
all.
don't I don't like that name, wild polio virus. I don't like that at
I don't like
all.
it either. So we still need to keep up the momentum. We can't just stop because if you stop, our gains will be reversed, as shown in Gaza. So it's not enough to say we are polio. They didn't have polio, but just because during the war there was disruption in immunization, immunity waned, there was a gap, and it came back. So we still need to continue what we were doing to keep our children and our people safe. So you also, what's the second question? You said three parts. I forgot the other one.
Yeah, I think you've answered that. It was the factors that could make the polio virus to reemerge in a country that's already polio free.
Okay, yeah,
You
yeah,
know,
yeah. Things
yeah,
like I said, low immunization
yeah, you've
coverage.
alluded to that.
Yes. Then
Absolutely.
importation of virus from areas where the polio still circulates. I told you,
Yes.
if it's anywhere in the world, there are still so things like that. Yeah.
So, in a nutshell, despite the fact that we're certified polio free, doesn't mean that we should say, okay, the battle is over. Let's put down our weapons and relax. No, we must
No.
always be on guard, always
God.
vigilant, always guiding, as they say. That's the expression,
Yeah.
always guiding. We need
Yeah.
to keep on keeping on to ensure that polio free actually remains polio free and not a function of, oh, it could come back because it is still out there. It's called wild polio virus for a reason. So we need to
Mhm.
be very, very careful. Let's take our first breather of the morning. And when we come back, we'll be talking about so much more vaccination, which is very key, and a lot of other things. We'll take some messages as well, and we will be keeping on this particular matter. This is Lagos Talks on the Smooth Breakfast on Smooth 98.1. Don't go anywhere. All right, progress, progress, progress.
We going?
I
Good.
said progress, progress, and more progress. A very
Okay.
quick break, about a minute, and we'll jump right back in.
No problem.
Huh, this is very interesting. I mean, just listening to everything the virus actually does, I always thought it was just a paralysis of the limbs. I didn't really realize until I read more
Mhm.
that it could affect the respiratory system and everything. I said,
Yeah. Ah.
why is it that these, all these diseases, infections, they're just so terrible, if that's the word I can use. I can't think of a better word. Just terrible.
People, yeah. But that's good. We are able to fight back. So
Yeah,
it's
Ali.
not meeting us unawares. We have
Yes.
the tools. Yeah.
And the fact that it's a battle that we actually are winning compared to a number of other medical battles all around. At least
Yeah.
at least this one is one that, okay, we're on the front foot and we can
Yeah.
actually deal with it if we
Yeah.
do the right things.
Yeah. But there's a threat to that, which hopefully we'll talk about vaccine misinformation and disinformation. We have anti-vaxxers telling you people don't vaccinate that. So it's a threat to these wins we have made.
And that in itself is very scary. It's very,
Scary.
very scary. The misinformation that
And
flies all around,
disinformation.
the things that you hear. I mean, I've had doctors come on the show talking about things they've seen in their practice. I think I had an ophthalmologist some months ago, if I remember correctly. I think we're talking about glaucoma, if I
Mm-hmm.
remember. And then she mentioned that she's seen patients that they came in and they said, oh, they applied breast milk to the child's eyes because they were told that it will help. And I was right here in this seat. I was open mouthed that how breast milk eyes, how?
I was told that too. I was told that so there are things we just pass around. When I had my kids, I was told that man, intelligent person, someone that went to school, like no, put seeds. That's what we've been doing. I did it for you.
Oh,
Okay. So culture is strong. They're very strong.
very,
Sometimes it's
very,
stronger
very.
than knowledge at times. Sometimes.
All right, let's get back in and spread the actual knowledge that needs to be put out
Yeah,
there.
yeah.
All right. And we're back. An insightful and very, very necessary conversation is being had this morning on Lagos Talks here on the Smooth Breakfast on Smooth 98.1. We love music, we love life, we love to talk about the things that actually matter. My name is Ayokunmi. Thank you for being a part of the show this morning. You need to join us because today it's all about World Polio Day. We are bringing the spotlight of putting the spotlight on polio and just letting you know that we fought the good fight, but the fight is not over by any stretch of the imagination. And this morning, it's a Dr. Anire Chima-Oduko. She is a public health physician. She's sharing the knowledge. She's spreading the gospel of what you need to know about polio. And believe me, you want to be right here. And you get to join us on the discussion because I'm pretty sure that you have a number of questions that you would love to ask, maybe some myths you've heard before that you just want clarified. This is your one-stop shop for all that information. So send your messages in on WhatsApp on 0911 999 0981 That is the WhatsApp number. You can also join the live stream on YouTube, Smooth 981 FM Lagos. Smooth 981 FM Lagos. You can leave your comments there as well. You can also give us a call on the studio line if you just love to talk to us directly. 0700 22 55 981. 0700 22 55 981. So please, calls only via the studio line. If you can't call on the studio line, just send a message on WhatsApp. It's the same at the end of the day. You will get the feedback that you actually need. All right, let's jump right back into this discussion, Dr. Anire. I mean, you've laid the groundwork here. You've made some very excellent points, and one thing that we need to actually talk about now is vigilance and the solution, which of course brings us to the vaccine and vaccination. But some parents actually get confused about why it's so constant.
Mhm.
Which brings me to ask the question: how exactly does the polio vaccine work to protect children? And why must children still receive the polio vaccine even when they look healthy?
Okay. So we have two major vaccines that we give to protect from polio. We have the oral polio vaccine, OPV,
Okay.
and the inactivated polio vaccine, IPV. So the OPV is the one most mothers recognize it. They just put it in the mouths of their children, in
Mm,
the mouth, you know. So it contains a weakened poliovirus, a weakened strain, very weakened one. So when
okay.
giving, it will replicate in the guts. And we already have an immune system. Everybody, you have an immune system. So your
Mm,
immune system, so it's prepared in such a form that it cannot cause disease, but it can trigger our immune system to react. So once it's put into the gut, the immune system will respond to it. It will identify it as a foreign body, and it will produce
okay.
antibodies. These antibodies are now stored in the body like memory cells, such that next time when another threat like that comes, the body already knows and quickly would have antibodies that fight it before it causes disease. That's how most vaccines work. They trigger your immune system. When they are introduced into the body, they will
Okay.
trigger your immune system to mount an immune response so that if the body it comes again, the body recognizes it and already understands it and is able to fight. So
Mm,
that's how it works, really. I don't know if it's clear. So we take it, our antibodies will neutralize it, and then the virus will shed in the feces. And like I said, um, it can also help to spread what we call herd immunity. The same way the virus is spread. When children take the vaccine and pass it in the feces, and if there's no clean sanitation and all that, other children get it, they also receive the vaccine, so to say.
okay.
Do you understand?
Yeah.
That is fast, yeah. So there's something called herd immunity. So improving immunity. So that is the oral one. Then the inject another one we inject, which also elicits strong systemic immunity, but because it's injected, it's not passed through the feces. You can't spill it out.
Okay.
So we give those two. So, but we need to do it many times so that like at least 3 to 4 times, so that our bodies are able to mount an effective response. So one dose is usually not sufficient. So you have to take it. There's a science to it as well.
Okay, if we say 3 to 4 times, is that within a particular window of an individual's life? Is it okay at one point during youth, at one point during adulthood, or when exactly will all those doses actually be taken or should be
So
taken?
so right now the immunization schedule in Nigeria, we give it at birth. We give it at 6 weeks, 10 weeks, and 14 weeks. So like 4 times. And then there are also supplementary immunization activity when they come to your home to give it over time. So you can still take,
Okay.
but at least 3 to 4 times is sufficient to help your body to develop an immune response. So 3 to 4 at birth, really at birth. So you want to give the child protection at birth when the child is born, because the immune system is very weak. So you want to do it when the child is born.
Okay. Now that is interesting. There's an interesting question here from Funke, who is in Lekki.
Mhm.
Funke says, Good morning, doctor. My child took the one at birth at the hospital. Does she need to take the one from the house-to-house people again? It's confusing.
Yes, she does. She still needs to take the one from the house to house people again. So that one is a different program. It's called supplementary immunization activity. It's supposed to supplement what is being done in the hospital. We know that some people may not come to the hospital, so we want to reach them. It's just to supplement what we are doing. So it doesn't affect you still collect from the hospital, you can still collect from the people coming. It doesn't affect anything.
Doesn't affect anything. Okay, now
Yes.
another question here, also a very interesting one. This is from David in Surulere, who says, Ayo, please ask the doctor. Dave, you can ask the doctor yourself now, but anyways, it's okay. Please ask the doctor why the vaccine is giving children the same polio. I watched one video on WhatsApp. It said the in quotes vaccine-derived polio is real.
Okay. Please repeat that question so that I'm clear. Say it
He
again.
said he says please ask the doctor why the vaccine is giving children the same polio. He then says I watched one video on WhatsApp and it said the vaccine derived polio is real.
Yes, there's such a thing called vaccine-derived polio. However, it is not as a result of the vaccine we give, it's because there are not enough immunized children. So
Oh,
yes, when there are not enough immunized children, it can. Do you understand? So it's not because we are giving the vaccine. It's because there are not enough immunized children, and it leads to vaccine-derived polio. However, we are also that's why we are supplementing with the one we inject as
okay,
well. Yes, and we are gradually going to phase out now. You know, I told you that when you take the oral one, it passes through the feces as well, and other
correct.
people can be protected. However, when there are not enough immunized children, it can lead to that. So,
Okay, okay.
but the solution is to make sure that every child takes more, so that their immune system is strengthened,
Stronger. All
stronger.
right. All right. All right, David, I hope that actually answers your question. Thank you for that. Keep those questions and comments coming in. Hey, this is what makes it a whole lot more interesting. Once again, the number is 0911 999 0981. Yes, indeed. Okay, so the point you made about vaccination is a very crucial one, really. And this isn't just about polio. So we need to talk about general vaccine education because we have a lot of misinformation out there, disinformation out
Mhm,
there that we need to set the record straight. So apart from polio, what other
mhm.
childhood diseases can vaccines actually prevent? And following that, why are vaccines so important for child survival and public health as well?
Right. So apart from polio, there we have vaccines for over 25 to 30 other diseases. such as measles, mumps, rubella, diphtheria, tetanus, hepatitis B, Haemophilus influenza, rotavirus, pneumococcus. There are plenty. Meningitis,
Mm,
yellow fever, and the new one we just introduced, human papilloma virus. We now even have a vaccine for malaria. Hallelujah.
amen.
So, yes. So, right now, our child survival rates are increasing. We have more children surviving to 5 years and beyond. In the past, like 50, 60 years, 70, or even 100 years, a lot of children used to die in childhood.
Mm,
If you ask your grandparents, they'll tell you there's something they call Ogbanje, Abiku,
Abiku,
different
yes.
a child that comes and does not stay, and it's all these diseases that kill them, but they don't know. So it's very important to vaccinate your child to protect against all these diseases. There's so plenty. So to protect against the disease and give the child the best shots at a healthy life. So that's why we advocate for vaccination. So vaccines are also one of the most cost-effective health interventions we can have. They are cheap
Okay.
compared to treat. Imagine if a child has meningitis or measles. Do you know how much you will spend in a hospital? The child will be admitted. You spend money on drugs. A lot
I
of
can't
professionals need to come.
I can't even begin to imagine.
Yeah, but just one shot, just one shot or just one drop can prevent that. So it's safe, it's cost effective. It's one of the discoveries and contributions of modern medicine to health, to our civilization and development. So it's so important.
Hmm. So very important. And we are going to reiterate the importance and just kind of, should I say, put some minds at rest when we come
Yeah.
back in from this break, because um, there are a number of people out there who tend to be skeptical where vaccines are actually concerned. So we're going to talk about that and just get the right pieces of information and what you need to know. On the other side of this break, this is Lagos Talks on Smooth 98.1. Don't go anywhere. We'll be back in a moment.
Thank you.
Pardon?
Okay, I was saying thank you. I thought you were talking to me.
Oh, no, no.
Sorry.
My eye just went to the clock and I saw, oh, there's a break on the horizon. So let me just stylishly take us out and then we'll come
Yeah,
back in and
it's
talk
it's
about
been it's been 30 minutes has gone so fast.
that's how it always is when when it's going like boom, 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 you're having a good time, it just flies by. If it were the other way around, it's like the time is creeping
So,
backward, something like
yeah, so short.
that. So sure. Before you know it, it's 9:50. Before you know it, it's 9:50. Believe me,
I
it's
really
not.
want I hope they can call in and just talk. It's good. And is there a way I can get the questions asked on WhatsApp? Can you
I
forward to
can.
me?
Yes, I can copy them from the studio line, and I'll forward it to you, Sha.
Yeah, so that I can also keep track and all. It also
I'll
helps us
forward it.
improve what we do. So like this question she asked, it helps us to improve our health education and health promotion and just know what's out there, what people are, the kind of concerns they have.
Yeah, yeah.
Mhm.
All right. No, no, wahala. I'll do that. I'll do that at the end of the show. I'll get them all together and send
Yeah.
them in
Yeah, the
to
one I've
you.
been chatting with.
Yes, indeed.
Oh, okay. Mhm.
Anyone here? Ah, a number of a number of people have a couple of questions concerning vaccines. So,
Oh,
okay. Let us come back in before I ask the particular question.
okay.
And we're back. Lagos Talks on the Smooth Breakfast here on Smooth 98.1. We love music. We love life. It's a feel good Friday morning, and I feel good being in the studio here with you as the usual. 32 minutes past 9 a.m. My name is Ayokunmi. Thank you for keeping it tuned to Smooth 98.1. And of course, two great conversation this morning, very eye-opening conversation this morning. We're spotlighting World Polio Day. That is what today is all about. So we're shaking tables, scattering the myths, breaking all those myths, and giving you the actual information. And you also get to have your questions answered. So all those burning questions you've had at different times or even have right now, you can let us know. Ask. The good doctor is going to answer your questions. 0911 is the WhatsApp number. The studio line to actually give us a call on is 0700 22 55 981. 0700 22 55 981. Okay, can you see the phone line blinking? Let me see who's on the line here. Hello, good morning. Ooh, please do well to call back. The gremlins are in the system again. 0700 22 55 981 is the studio line to give us a call on if you'd love to ask the question directly or talk to us in the studio, make your observations and your comments as well. So Dr. Anire Chima-Oduko is my guest. She is a public health physician. She is doing the good work here, spreading the gospel of correct information, dispelling all the myths and rumors that you must have heard about polio. Welcome back in, Dr. Anire. It's been great having you on the show so far. And there's still more to talk about this morning. Talking about vaccines and how important they are for child survival and for public health as well. We need to talk about one of the biggest elephants in the room, and that is trust and safety. Because
Yeah.
parents tend to worry, especially with so much information online. So, my question directly is, are vaccines really safe? I mean, what side effects should parents actually expect, if any? And is there a way that they actually, tested and monitored to ensure that, okay, they're fine, they're safe, and they're good for consumption?
Yes, they are. So before approval of vaccines, most vaccines go through years and years of rigorous testing, preclinical studies, first with an animal, a rat, then from there to a human, at different stages and multiple phases. So there are clinical trials done to assess safety and effectiveness. So you
Okay.
don't just it's not they don't just wake up one morning to just say, oh, take a vaccine. Before a vaccine reaches your child, it has gone through at least 5 to 10 years, at least,
Oh, wow.
of rigorous testing on animals. Then when it's found safe in the animals, it now goes on to humans at different stages. So they are safe and they are effective. Okay. Yeah.
All
The
right.
only one that didn't go through so much that long time was COVID
COVID,
because of
COVID-19, yeah.
the situation and because people were dying so much. So they had to rush the process. But every other vaccine has a protocol, a process that takes years and years of watching, of seeing. So yeah, vaccines are actually very safe.
All right, you heard it,
And
people.
also, there are also something when you give a vaccine,
Okay.
um, there are some slight side effects you see. For example, there are some vaccines you introduce and you see that the child has fever, but after a while, or redness or swelling, it's just the body reacting to receiving a foreign antigen and the reaction. It shows the vaccine is working. However, like I said, the amount of antigen placed in the vaccine is not enough to cause disease. It's just
Okay.
enough to elicit an immune response so that the body can build its own response to it. So all those symptoms are very mild, and every vaccinator is trained before after you give a vaccine. A child is supposed to wait for a while you watch to see if there's any adverse effects. Okay, before you let the
Right.
child go.
Right.
So having a bit of fever is normal. They'll tell you it's normal. Just let it go. Don't do anything. Don't rub. Over 2 to 3 days, the child is fine. In fact, in the next day, the child is okay. So they are quite safe. We've been giving vaccines for over 100 years, if not more. And
That's a long
humanity is
time.
fine. Yes, and we're good. You were probably giving a vaccine. I'm sure your dad, your parents were giving vaccines, and we've been fine. So vaccines are safe and effective.
Huh. Thank you for being so very clear about that and setting the record straight. I mean, this I would say it's a massive national effort, and we see the results in our communities. And talking about our communities, I just wonder, I mean, why do vaccination teams actually go house to house during campaigns? And what is it that communities can really do to support the vaccination efforts within their areas?
Okay. Earlier I talked about what we call, so in every country we have routine immunization programs, part of our immunization schedule. So if you're a mom or a dad, you have a baby, you know that you have an immunization card with all the vaccines the child is supposed to receive. So that's part of the routine immunization schedule. But we also have what we call supplementary immunization activities to ensure that no child is left behind. We know that there are some people that might have problems with access to the hospital. Some people, due to challenges, may not come to the hospital. So we still take out, because of how important it is, and how some children, just some children, can affect public health on a large number of people. We take
Mm,
out time to still go and still meet people, just so that we can still reach those who may have missed it, or have missed a dose, or just to give booster doses. So that's why we do house to house. It's not every time, from time to time. Those are called national immunization days for certain
right.
targeted diseases. Yeah, that's why we go.
Yeah.
So how can communities help? They can help by being supportive. You can encourage parents and caregivers to bring their children for vaccination. You can host local awareness sessions using trusted voices. Okay, people trust. People listen to those they trust. So if you are a leader
True.
in your community, speak up, encourage other people, because you're not just doing it for yourself. You're doing it for your community. If one child is at risk, 10 others. For every one child that is at risk because he or she is unimmunized, that child can affect 20, 30, 40 people. I don't know if you've noticed, if there are parents listening to me, you notice that during holidays, children are usually well healthy, but the moment they go back
Mm,
to school, they come out with flu, they start having cough, they have
all
catarrh,
sorts.
all sorts. Why? They've come in contact with other children and they've mixed and gotten a virus or something from them. So that's the thing. We want, so any as long as you have except you don't want your child to mix, which is not possible. So once one person in the community is at risk, 10, 20, 30 others are also at risk because they come in contact with people. And these viruses, just by talking to someone, you can spread it. So that's why we go. So it's important
Hmm.
that communities encourage their members to take vaccines, not just for themselves, but to keep the entire community safe. And then it's important that you combat misinformation. Don't spread, if you don't understand something, ask a doctor. They are trusted voices. Don't listen to health information from a market woman or from a novice.
Listen to trusted sources.
Social media, yes, go to websites you can trust, like the World Health Organization, the Nigerian Center for Disease Control. Talk to your doctor and ask your questions.
Mm,
So, and
yes,
don't
indeed.
spread bad false news.
Very, very key. Trust your doctor. Listen to them for the right information, like Dr. Anire. She is spreading the right information. And of course, on Smooth 98.1 by extension. Let me go back to the messages. This is from an Alaji Sonny in Ajekunle who says, thank you, doctor. I am a community leader and we always work with the vaccination teams. They are our heroes. Parents, please cooperate with them. They're just trying to protect our future. All right. Thank you, Alaji Sonny, for that message. Um, this one is from Bosse in Ikurudu. I think you kind of alluded to this, but I will read the message regardless. It says, "Good morning. My pastor said the vaccine is not good for us. How can I be sure? My child is 6 months old and I'm scared."
Okay, so that's why I'm here. Can you
Hmm.
hear me, Ayo?
Yes, yes, clearly.
Okay, so that's why I'm here. So we have people that are called anti-vaxxers. For whatever reason, I don't know why. What they have their own. Everybody has their own motivation. They're trying to discourage people from being vaccinated. They say all sorts of things, and it's wrong. It's wrong. I don't want to come and paint anybody black. That's not why I'm here. But when you want information about how to take care of your money, who do you go to?
A financial advisor.
I am asking you. Can you hear me?
I'll talk to a financial advisor.
A financial advisor. Okay, exactly. If you want, what other things? So, but when it comes to your health, who should you? If it's spiritual matters and God, who should you go to?
Go to the pastor, go to the imam
Your
or whomever.
pastor. For your health, who is the best person to advise you about your health? Is your doctor who went to school to study it for how many years? Not someone that is not. So people have their motivations, please, of saying, oh, don't take. Please do not be scared. You are doing your child a great service. You are doing your child a great favor by vaccinating him or have already explained that you cannot see. There are many viruses around, viruses, bacteria, all sorts. And imagine exposing a baby. Even us as adults, we have some immunity. Some, no, we don't even have, but we have at least some. But a baby that does not, that is just growing, he or she is weak.
Hmm,
The immune system has not fully developed. So if you
correct.
leave the child without immunizing the child, you are like saying, okay, go there by yourself. Anything you see, take it like that. So no, immunize your child. It is safe, like I said. You can also do more research if you are unsure
Okay.
by yourself at trusted journals. Yeah, you
All
want to
right.
say something? Let me stop here.
Yeah, I was going to take another message from Obina Gallagher, who says, good morning. I have a question regarding vaccines imported into our country. Do
Mm-hmm.
our pharmacists thoroughly analyze the components and ingredients used in important vaccine production to ensure that no harmful substances are included before certifying them for use? I'm concerned about the safety protocols beyond just testing for efficacy, especially as we Africans have raised concerns about potential motives behind certain imported vaccines since Bill Gates intended to reduce the African population. I don't know where you heard that one, Obina. I'd appreciate clarification on this matter.
Don't hear that one from. Where
I,
do you hear that? So that's
I'm
another
also
thing about
wondering.
disinformation and misinformation. And how can you just say, oh, this man wants, somebody just woke up one day on WhatsApp and said, this man wants to kill our people, and you believed? What are the evidence that points to that? So you don't just say things like that. But answering your question, Nigeria, we have many challenges, which I don't want to go there. One of
Mm,
our challenges, one of our challenges is that we do not produce most of the things we use.
yeah,
And it's not just for drugs or medicine, almost everything is imported. So it's part of the challenges we have, and I think it's something the African region is working on producing our own things ourselves, which we can. So we've not reached that level yet, where we produce our own vaccines. Yes, I'm not involved in the whole testing and all, but before we are given a vaccine, there's some form of testing that we do to ensure that it's good for our people. But we do not produce our vaccines here yet. We've not we've not reached that capacity, and we are hoping that there will be an improvement in our health system to get us there. Funding and all that. It is another ball game.
another ball
Does
game,
that answer
and
the question?
right, right. I hope so. I hope so. Okay, now we need to deal with some of the common myths, but oh, I need to take a pause here. Final break before before I get too invested. Final break, and when I come back, we'll take a look at some of those myths and some of the misconceptions about vaccines that we need to
Okay.
correct today. So, quick break. We'll come back in, continue the conversation. Lagos Talks on Smooth 98.1. The less I say, the better because we're on YouTube. Hmm. The less I
Okay.
say, the less I say, the better. You know, some of these conspiracy theories that tend to fly around.
Plenty. There's so plenty. And some people have, I don't know, everybody has their own motivations and goals and what they are gaining from that. So take it with a pinch of salt.
Two pinches of salt, Seth. Two pinches of salt. Because at the end of the day, like you said, we've been taking vaccines for hundreds of years. And whether we like them or not,
Mhm.
you can't just have a child and just leave the child to the elements. Wait, okay, well, Let's see what happens. That's
Yeah.
like going back. That's like
Except
going back back.
you want to be having babies.
That's like going back to the times when child mortality was really really huge. I don't think we want to
Very
do that.
high.
I don't think we want to do that at the risk
I
of
don't.
we don't know what's in the vaccines and so on and so forth. It's not
Exactly.
the payoff is not that doesn't make it for me.
Exactly. It doesn't make it.
Alrighty. Welcome back into Lagos Talks on Smooth 98.1. We're getting to that point where the plane is beginning to approach the tarmac to land, but we still have a couple of things just to touch on here and there and get across to you in terms of information. My name is Ayokunmi Kekere, her conductor. Anire Chima-Oduko is my guest. We are talking about polio this morning, and you get to ask your questions and your comments as well. They are most welcome on 0911 999 0981. That is the WhatsApp number. Studio line is 0700 981. So there's still a little bit of time for you to get those thoughts and comments across to us. Now, as I mentioned before we took that brief pause, we're going to talk about the myths and misconceptions, common myths and misconceptions about vaccines. And I know that a couple that you would love to actually clarify and lay to rest today.
Yes, there. I don't want to. Yeah, there are a couple of myths that we've heard. Some people have already even mentioned it with their messages. So I'm not going to repeat it because I do not want to propagate wrong information. There's something I've discovered that wrong or bad information sticks better than good information. Have you noticed that? When you tell
True.
someone when they hear something about that's the one that will stay in their head. So I'm not going to repeat some of them. We've already heard it when one of the messages said my pastor said I shouldn't take. I'm scared. Another one said why does the vaccine give you the disease? And I've explained. But there are so many, which are all wrong and unfounded. They are unfounded. That's all I'm going to say. Vaccines are I heard that there's the one we promote HPV, which was supposed to HPV, human papilloma virus vaccine, against
Right.
cervical cancer, which people are supposed to be rejoicing for. I mean, how many vaccines prevent cancer? Cancer, most times, there's no prevention. And then we have one, and then somebody comes up and say, oh, it causes infertility. It wants to, do you understand? So there are so many bad things we've heard which are wrong. We call them disinformation and misinformation. All I will say here is that vaccines are highly regulated and safe. They do not cause infertility. They use minute, tested amounts of safe ingredients, and
Okay.
they do not cause diseases. They use a weakened form. Okay, so they are safe and they've gone through rigorous testing. So anything you hear that is negative, I'm not saying, oh, don't just disbelieve it. Go and test it. Go and ask. Do your research. Go to trusted sources, people that are supposed to know more about it. Like two or three voices, trusted people that are knowledgeable in that
Mhm.
field. A doctor, you can go to scientific literature if you know how to do that and see what is the evidence saying and make your conclusion. So don't just see something on WhatsApp or and just believe it without verifying. That's all I can say.
All right, let me take this message. This just came in at a very timely point, just as you finished speaking about that. This is from Mary in Ikeja. She's a nurse, apparently. She says, "God bless you, Dr. Anire. Very clear explanation. I'm a nurse, and I believe the fight against misinformation is our biggest battle, not even the disease itself." Well, there
Yeah.
you are. Uh, this
Thank
is this is
you.
Grace in Alimosho who has a question. Grace says, "Where can I get the other vaccines, not just polio? Is it only polio that is free? My local PHC, I think that's Primary Health Care Center, I believe, sometimes say they don't have stock."
Okay, so she wants to know where she can get free vaccine or what? I
Well,
didn't get the
get the
question clearly.
okay. She says, "Where can I get the other vaccines, not just the polio vaccine? And is it only the polio vaccine that is free?"
No, every vaccine in the routine immunization schedule is free. every vaccine, okay, from and there are over, we have in our routine immunization schedule, we have vaccines against tuberculosis, we have against diphtheria, pertussis, tetanus, hepatitis B, Haemophilus influenza type 1B that causes pneumonia. We have against pneumococcus that causes pneumonia as well. We have against measles, yellow fever, meningitis. And then recently, the human papilloma virus vaccine for girls 9 to 14 years was also introduced. They are all free.
Okay.
However, if you're outside the ages of under 5 or 9 to 14, then the vaccines are not free for you. They are free only for children. And then there are other vaccines that are not covered. For example, we have a vaccine for typhoid, we have a vaccine for chickenpox. Those ones are not covered under the routine immunization. You have to pay for them by yourself. So maybe
Oh,
that's what she's
okay.
asking for.
Probably.
But the ones under
Probably.
the routine immunization, those ones the government pays for them. So they are free because of the public good they are.
Right, right. All right, Grace. I hope that actually answers your question. Man, time really, really has flown by. We talked about this off the air, the way time actually flies. But before we wrap it up this morning, Dr. Anire, we're having a conversation at the beginning, and there's something important that you actually wanted to put out there.
Yes, yes. So I'm doing today is flags off a 33 days campaign. I and an NGO that I'm affiliated with is running Healthy Pink Health Initiative. We are doing a 33 days campaign to promote vaccines, promote immunization. And I just want to encourage everybody listening to follow on Instagram. We are on Healthy Pink Initiative. And we're just join the conversation. We can continue the conversation from here. If you have other questions that I couldn't answer today on vaccines, the benefits. So for the next 33 days, I'll be spotlighting various vaccines, their
Right.
importance. So today is polio. On November 12th, we'll be doing pneumonia, then we'll do HPV, human papilloma virus. So I'm just doing a campaign to just share the good news of vaccines and how they can protect your health and health of your children. So yeah, that's what I'm doing. So you can follow on Instagram, Healthy Pink Initiative on Instagram, Healthy Pink Initiative. That's it.
All right. Thank you so very much, Chima-Oduko. She is a public health physician, and thank you so very much for everything that you do in spreading the gospel about polio, about vaccines, about everything health-wise for the betterment of Nigeria. Very much appreciated.
Thank you for having me. Thank you.
All righty. Do have yourself a great Friday and a great weekend as well.
Yes, thank you. You too.
All right, Lagos, Nigeria, the entire world, wherever it is you're listening to us right now. Thank you all so much for being a part of Lagos Talks this morning. All your messages and your contributions, very much appreciated. And always keep it tuned to your love music, love live station Smooth 98.1. My name is Ayokunmi Kekiriak on the Smooth Breakfast, of course, kicks on. I've got some feel good Friday music lined up for you all the way till 11. And then it's going to be all about the big screen movie series and everything in between on Film Focus. Keep it tuned.